My question for the Minister of Health. Minister, as of last night, there was 10 COVID-19 active cases in Northern First Nations. There are 6 in Casabonica Lake, 1 in Sandy Lake, 1 in Piginchicum, and 2 in Moose Factory Island. Speaker, as Ontario enters a second wave, this series of cases in remote First Nation is beyond alarming. With the housing crisis, chronic problems with clean drinking water, enduring illness affecting remote First Nation, this government should have acted proactively. Instead, it remains passive, only reacting to reality. Speaker, why has this government continued to drag its feet and failed to preempt this situation that risks of spreading like wildfire in remote First Nations in Ontario?
Minister of Health.
Thank you, Speaker, and I thank the member very much for the question. I know this is a matter of serious concern to you, as it is for us as well. This is something that we have worked throughout this pandemic with members of First Nations communities, with the federal government, with the provincial government, working in a tripartite manner to try and protect and contain any outbreaks in the First Nations communities, because we know they are particularly vulnerable for a number of reasons. But I can assure the people of Ontario and the member that this is something that we are working on right now through Dr. Dirk Heyer with the outbreak management team to make sure, first of all, that they have the supplies that they need in order to provide people with the equipment they need. We're doing testing, we're doing isolation where in situations where that's possible, and moving people around to hospitals and other locations. But this is something that we do take very seriously and have been working on this throughout, particularly now.
And the supplementary question.
Speaker, back in March, the Minister of Health deemed James Bay area as low risk for dealing with COVID-19. This means that the Conservative government had put one of the most vulnerable populations in their province at the bottom of the list. So they had to wait for over 3 months to receive critical equipment, like ventilators, to prepare for what is today a reality. And as Muskegwa Grand Chief Solomon mentioned this week, the tests coming from James Bay are taken to laboratories in Timmins, processing that in 300 kilometers south of Moose Factory Island. Results have taken 4 days to reach back to James Bay, which has delayed contact tracing. Speaker, is the minister satisfied with this 4-day waiting time?
Question.
And why has she failed to provide rapid testing to First Nations as it was promised months ago?
Minister of Health.
Thank you, Speaker. And I would say, through you, Speaker, to the member, that we have always considered all of our Indigenous communities to be subject to particular vulnerability with respect to COVID-19. That has always been the situation, and we have always worked throughout, including regular engagements with the Minister of Indigenous Affairs, as well as with myself, having close contact with members of the communities to make sure that they have the supplies, to make sure that the testing is being done, to make sure that they are protected, because we knew that this was a community that could be susceptible to COVID-19. That has continued throughout, and we have worked with the federal government as well to make sure that they are doing their part as well. But I would also indicate that we have spent money. We know that we need to provide additional services. We've provided $37 million to these communities in the face of COVID-19, includes $16.4 million to help with the distribution of goods, transportation support for urban Indigenous people, self-isolation, prevention awareness, and pandemic planning. We have also spent $10 million to ensure continuity of services, $7.4 million to ensure that social service providers have the...
Thank you very much.